Your next comic, please welcome Judith Essex.
I'd like to introduce to you my 5-point plan for achieving normality. Step 1. Reconnecting with your family. Or in my case, my family. My brother and his new wife came over last Christmas. And they were at the house. Well, I thought I'd lock them down in the cellar. That was really terrible, except I'd forgotten to tie them up. First. And secondly, their banging on the door was driving me crazy. Step 2. Overcoming adversity. I sprained my right ankle, and I became more dependent on my left foot. This led to me walking strangely in a sort of zombie march, and it freaked the neighbors out. People started laughing and pointing and shouting things like, "Hey, Spaz, get out of the road." Little children ran away from me. Buses and taxis refused to stop for me. But the good thing is, I got temporary employment. I got cast in Nights of the Living Dead 5, 6, and 7. Step 3. Moving through the mental health system with confidence. At the mental health agency where I go to get services, they sometimes didn't have enough office staff, so they would fill the receptionist position with temporary workers, very young temporary workers. One day, I went to the office to cancel and reschedule an appointment. And the temporary worker, who obviously watched a lot of television, was already on the phone with another outpatient. I meant client. And I was insistent that my time was as precious as anyone's. Well, she said she was way too polite to say, "Really, you need to sit down and wait your turn like everyone else." I went down. She started to have a conversation with the other patient. "Mr. So, I'm sorry. Dr. Who's-It has gone home for the day. Please sit down, miss. You wait, I can't hear you, miss. No, wait." At any rate, the poor child was trying to have a coherent conversation with two decidedly dissatisfied clients. The result of all this was that Mr. So got, or rather it was me, got my appointment to go to the gynecologist, and I got all 3 numbers for the mobile outreach unit. I don't have health insurance, so the pharmacy at my MHA will generously provide me with samples. If they don't have the samples I need, they'll just change my diagnosis. So I've gone. So I'm afraid I've gone from schizophrenic to shingles to syphilis and back again 3 times in the last month alone. do this, I need a caseworker. Done.
Uh-huh.
And then I need an advocate. Or is it a lawyer? Oh, or a lawyer. They aren't one and the same, you know. The difference is about 25%. I think I'll just stick with samples for now. If I wasn't a mental case before, this process will definitely drive me crazy. Step 4. Managing my symptoms. My newest diagnosis is OCD, so I do have a lot of checking behaviors and repetitions. Checking behaviors such as checking to make sure I hung up the phone twice, checking to make sure I turned off the stove twice, checking to make sure I locked the door by unlocking it and locking it again, checking to make sure that I let the cat out, even though he's been missing for 3 or 4 years. I once dropped a CD and scratched it, and that was so traumatizing that ever since then I've been super careful when it comes to putting away other CDs. It takes me way longer to get it done. And my last time was 3.4 minutes. And then I opened it up and did it again just to be sure. I write down appointments 5 or 6 times. And worst of all, I flush the toilet 3 or 4 times. Yes, that's right. I flush the toilet 4 times. I'm what you call a 4-flusher. Okay, you all just revealed how old you are. Step 5. Taking charge of my recovery. I go to Flushers Anonymous. I'm afraid this organization is still a work in progress because everyone there is so busy flushing the toilet they never quite get to the meetings. Or we'll all meet in the bathroom and no one can be heard speaking over the flushing. You can spot us by looking at our water bill. If I were an alcoholic, I would go to Alcoholics Anonymous and it would go like this. I'd say, "Hi, I'm Judy and I'm an alcoholic." And everyone around me would say, "Hi, Judy." At Flushers Anonymous, I say, "Hi, I'm Judy and I'm a compulsive flusher." And everyone around me would go, At the end of 1 year, instead of a cake, they give us a plunger. Now listen, there are only 2 things you can do with a cake, but there are lots of things you can do with a plunger. Fortunately, I don't have time to name them all. Thank you all very much.